Dr. Lindsey here. I'm going to share a very brief discussion on an article out of Dermatologic Surgery. This is volume 49, number 10, October 2023, and it addresses a question that I've been asked 200 times this year, and that is, can you get hair from somebody else, like your brother, your sister, your cousin, a stranger, somebody who needs money, and put it in your head? And up until now, my answer has been, no, you can't do that. The answer, and the reason is, even if you're twins, you don't have exactly the same type of immune responses on your cells that your twin would have. And while you can do kidney transplants and other type of organ transplants to allow close matches tissue-wise for organs to survive, that requires the long-term treatment of immunosuppressive medicines, many of which cause an increased risk of skin cancer and often thin your hair. We see a fair number of people in here who have had a transplant that have finer hairs that are probably exacerbated by their transplant medicines. Well, on page 977 of this, the title of the article is Allogenic Hair Transplant in a Kidney Transplant Recipient. And I found this pretty interesting. This is I'm just going to give you the high points. This is out of Romania, done by a Felix Mircea Popescu and Sansui Umar, both doctors, at the Dr. Felix Hospital for Hair Restoration in Bucharest, Romania. And so I don't know these guys, but it is pretty interesting. And what they had was they had a 60-year-old man who had gotten a matched kidney transplant from an unrelated friend 2 decades earlier. And he'd been on medical therapy for hair loss, but he didn't have a whole lot of hair. So he talked to the fellow that gave him the kidney, and they did, and these two doctors did 2,350 FUEs from the kidney donor and placed them into the kidney recipient. And they show pictures at 9 months post-op. I'm just going to hold these up. So, before, after, and 9 months. And that's a pretty typical result at 9 months. Well, it's a little fine hair, but it's a pretty good result at 9 months if you do use your own hair. And so I thought this was very interesting. It's not really applicable to you, the potential patient, currently. I suspect over the next decade or two, if our society still exists, that there'll be many options, including cloning and using hair from other people and modulating the immune system. That's not here yet. But this is the first report of using hair from somebody else to fix baldness that I've seen, and I thought it was interesting. And since I get asked that question all the time, I thought I'd share it with you. If we can help you, give us a call.